Welcome to this segment of In the Loop. I am Marlaine Potter, and I am the Administrator of Special Education for the Wilmington Public Schools. This segment will focus on certain aspects of special education in our school district. Specifically, we will highlight the referral process, how a child is determined eligible for special education services, and certain programs and related services in the district. Please be mindful that this presentation is meant to be a brief overview of these topics. My guests today are Mary Ellen Lewis. She is one of our district team chairpeople. And Suzanne Garbarino, a district school psychologist. And Mary Houde, a curriculum team leader for grades 6 to 12. With us today is Mary Ellen Lewis, and she is one of our 3 district team chairpeople. Welcome, Mary Ellen.
Thank you.
Mary Ellen will begin our segment by explaining how a child is referred for an evaluation to determine eligibility for special education services. Mary Ellen, how old must a child be to be referred for a special education evaluation?
A child must be at least 2.5 years old to be referred for an evaluation, and this is typically done from early intervention.
What is the age range of children eligible to receive special education services?
The age range is from 3 to 22 years of age unless the student earns a high school diploma.
And who typically refers a child for an evaluation?
Schools have the duty to identify and assess the needs of children who may be eligible for special education services. However, a student may be referred for an evaluation by a parent, any person in a caregiving position, any person in a professional position who is working with that student. This can be a doctor, a teacher, a daycare provider, a coach, counselors, early intervention, or instructional support teams. These teams are composed of professional staff members that review the student's school functioning.
How soon is the district required to respond in writing to a written request for an evaluation?
The school district must send parents a form requesting their permission to test their child within 5 days of receiving the referral.
In what area or areas would the district propose evaluating a child?
The district would evaluate the student in the area of suspected disability. An example of this, if the student was struggling with fine motor deficits or weaknesses, they would do or propose an occupational therapy evaluation.
How long does the eligibility determination process take?
The complete process occurs in 45 school days. The district must evaluate the student within 30 school days of receiving the consent. The district then has an additional 15 school days to schedule a team meeting to review the findings.
Thank you, Mary Ellen.
Thank you.
Also with us today is Suzanne Garbarino, who is one of our school psychologists. Welcome, Suzanne.
Thank you.
Suzanne will share with you information about the evaluation process. Suzanne, if a child has been referred for an evaluation, how would you suggest a parent explain to the child what it's all about, what to expect, and how to best prepare the child for the testing?
Okay, well, of course, how a parent might want to prepare the child for testing depends on his or her age. They may want to let their child know that they're going to be working with some different teachers, and certainly reassure him or her that there's nothing to worry about, and that these teachers want to find out how they learn so that they can teach them the best way. Of course, parents want to really encourage their child to try their very best in testing.
That's great advice. Thank you, Suzanne. And Suzanne, what are some of the areas that a child might be assessed in?
Much of that depends on the referral question. For example, if the child is being referred for an evaluation because of academic concerns, in that case, the evaluation would consist of a classroom observation, cognitive testing, academic achievement testing. Should there be questions about possible reading disability or language difficulties or even fine motor weaknesses, additional testing would be done by those specialists. And with regards to the psychological evaluation, additional testing could focus on attention, behavioral, or social emotional issues.
There sounds like it's a very wide spectrum of areas that the district can assess a child.
That's correct.
Is the child observed in the learning environment?
Yes, the child is observed in their classroom setting or natural setting, whether that is at a private school or it could be a family daycare situation.
Great. Who conducts the assessments?
The psychological testing is administered by a certified school psychologist. Academic achievement or learning style, that portion as it's sometimes referred to, is typically administered by a special education teacher. Other assessments, such as reading, would be completed by a reading specialist. Speech language and OT evaluations are administered by certified speech pathologists or a registered OT.
And where are the assessments conducted?
These tests are administered individually, usually in a quiet setting at the student's school.
What type of information can you expect to gather from a psychological evaluation?
The psychological evaluation can provide an overview of the student's overall cognitive abilities and also identify areas of strength and weakness. Should the scope of the evaluation include social emotional testing, that would help identify underlying issues that may be impacting the child's behavior or social emotional functioning. There are also additional assessment tools that can be used if further questions or concerns arise.
And Suzanne, how long does the psychological evaluation take to administer?
Well, as I mentioned before, testing is administered in a one-to-one setting. Depending on the scope of the evaluation, it usually takes 2 to 3 one-hour sessions.
And how are the results reported?
The results are reported in a written report that summarizes the findings and any recommendations that may benefit the child. They are also presented at the time of the team meeting.
And does a parent have a right to see the assessment report prior to a team meeting?
Yes, upon request, the parents have the right to see the report 48 hours prior to their child's team meeting.
And I can see it would be very valuable to a parent to read that prior to the meeting.
It certainly is.
Thank you, Suzanne. Now we will return to Mary Ellen, who will share with us information about the team meeting. Mary Ellen, how does a parent know when the team meeting will take place and where it will be held?
A team meeting invitation will be sent to the parents a few weeks prior to the meeting. This will include the date, the time, and the location where the meeting will be held. This will also list all the team members that will be attending the meeting.
And if that date and time is not convenient for the parent, what should they do?
The parents or the guardian should call either the child's school and or the special education office, and they should come up with a mutually convenient time and reschedule the meeting.
Is the parent considered a member of the team?
Yes, an essential member of the team.
Does the parent have the right to bring other people to the team meeting with them?
Yes. Parents should notify the district in advance if they will bring other team members with them.
And who might they bring? Who might a parent bring to a team meeting that would be helpful to them?
Parents and guardians can invite other individuals to attend who have knowledge or special expertise regarding the student. This could include advocates, outside psychologists, doctors, counselors, and other individuals that work with the child or the family.
How is eligibility for special education services determined?
At an initial team meeting and at every reevaluation meeting thereafter, the result of any assessments should be discussed. The team, as a group, then determines whether the child has a disability, whether the child is making effective progress, and if there is a lack of progress, whether it is related to the child's disability, and finally, whether the child requires specially designed instruction and or related services in order to access the general curriculum.
Mary Ellen, what happens if the child is found ineligible for special education services?
If a child is not eligible for special education services, they may be eligible for other services. The schools have a wide variety of services outside the special education. Examples of this at the elementary level are lunch bunch or reading recovery.
How does the team proceed if a child is found eligible for special education services?
If the child is found eligible for special education services, the team will develop an IEP, which stands for an Individualized Education Program.
And what should a parent expect to find in an IEP?
An IEP is a document that details the child's educational needs and the school's plan to meet those needs. This includes, among other things, services that are being recommended.
Mary Ellen, if services are recommended by the team, when would they start?
Services begin once consent is received in accordance with the dates that are reflected on the service delivery grid.
Thank you, Mary Ellen.
Thank you.
Also with us today is Mary Houde, our curriculum team leader for grades 6 to 12. Welcome, Mary.
Thank you.
Mary, what are some of the related services available in the Wilmington Public Schools, and how are they delivered?
We have a wide range of services available to meet the needs of students who are on individualized educational programs. For example, we have occupational therapy, physical therapy, speech and language therapy, counseling, and social skills groups. Most of these services are primarily delivered in the school setting based on the IEP team's recommendation. Services are sometimes provided in the general education class and sometimes outside of the classroom in a small group or an individual setting.
Great, thank you. What are consultant services, and who would provide those types of service?
Any service provider, if recommended by the team, can serve as a consultant to anyone else on the team.
So it sounds by providing consultant services like the team works very closely together.
They do. They support each other and offer advice in working best with the child.
What is the spectrum of services offered within the district?
Services range from the least restrictive environment, such as a special educator offering academic support inside a general education classroom, or a service provider giving related services inside the general education classroom, to some services in the class and some outside the classroom, and then all the way up to receiving all the classes in a separate setting taught by a special education teacher.
Great, and thank you. And how and when is progress reported to the parents?
Individual IEP goals and objectives are reported on as frequently as typical students receive an academic report card.
Can the service delivery be adjusted? And if so, why would this be done and how?
The service delivery can be adjusted at any time when the team deems it necessary. The team can be convened at any point, and at a minimum, that would be done at the annual IEP review each year.
Great. And how would a parent best approach communication regarding their child's school experience?
Communication should begin with the classroom teacher or a service provider, and then extend to all members of the team as needed. We encourage parent and school communication as often as necessary.
Is there a special education parents group? And if so, where is there information concerning this group's activities?
Yes, we have a group called the CPAC, the Special Education Parents Advisory Council, and you can find information about them on the Wilmington Public Schools website.
Thank you, Mary.
Welcome.
We would like to thank you for taking the time to view our segment of In the Loop, and we hope that you have found the information worthwhile. In closing, I would also like to thank Mary Houde, Suzanne Garbarino, and Mary Ellen Lewis for joining me today. Thank you.